Hello, everyone. This is Dr. Marzban from Marzban Family Chiropractic, complete and leisure centers. Today, briefly, I'm going to be talking about manual therapy and how it helps with the pain and mobility in the patients that they need. And the manual therapy basically is referring to the hands-on technique, which is treating the musculoskeletal system. And if there's a dysfunctional pain in the system, it is going to be helping those patients. And with manipulation, mobilization, which happens with the muscles, joints, and connective tissue, the aim of that would be to reduce the pain and increasing the functionality of the joints and promoting the healing process, and see how that works. And the therapists and physicians, including the massage therapists, the physical therapists, chiropractors, as well as the osteopathic medicine, they're trained to help the patients with multiple different issues that the patient comes with, the pain and dysfunction. For example, the massage therapists, they are trained for the soft tissue technique and lymphatic drainage and vascular flow, and those are very specific for the massage therapist treatments. And beside that, the chiropractors and osteopathic medicine and the physical therapists in many areas, they are also helping with the manipulations and movement of the joints. But the aim of the aim of all of these therapists is helping with the movements and joints and the functionality of the health and promoting health. But beside that, they are having different approaches that they are trying to get to that goal. And here is that what a group of people might be benefiting from the treatments, and basically everybody, and young, old, and somewhere in between, however it is, all ages, they are in needs of getting the maintenance care at least. And if there's a trauma and anything else that happens with that causing the pain, that is going to be something that these therapists can help as well. And so what is the joints, basically, with the movements that we are talking about and how the manual therapy can help. So briefly, if we look at the vertebrae in the spine, and here is the disc that everybody is familiar with, and this is becoming very unprofessionally and very loosely being used by not only with the patients, by the patients as well as the many physicians, and they are using this one very freely without the responsibilities to be emphasizing what they're talking about. And but again, this is a disc between the vertebrae, and they are only between the bodies of the vertebrae. But beside that, we have other type of joints that not many people are familiar with, which is going to be called the facet joints. And these facet joints are very important for mobilization and the in different directions of the spine. And so what is happening in many cases, we're going to be going to this slide. And basically what we have here, here's the disc, here's the facets, and the joints would be right here. But beside that, we have the ligaments that covers the joints, and as well as the ligaments that are found at the upper cervical and to the skull. And all of those ligaments can be an issue that the patient is feeling pain and coming to the office. So beside that, we have also muscles that wrap around the joints in order to do the protection, but mainly for the movements that is very essential for the anybody to have right posture, movements, and good health. But in the vertebrae in the back area, which are similar type of formation of the joints, but they have different functions for the body. And when this pain is being formed to the point that these nerves are going to be receiving the signals to send it to the central nervous system. Here we have again the disc, and here is the facets, here's the muscles and the ligaments, and they're all working together to give the right appropriate type of function and movements. But sometimes what happens is that the joint is going to be being dysfunction, and for different reasons. And instead of having a normal amount of chemicals in this area of the joints, we also going to have more and also other chemicals added to the joint, which are causing the inflammation and pain. And by doing so, the joint does not have the correct function, as well as it is going to cause pain. And not only with this type of joints, could be in the like shoulder or hip area, but also then the central nervous system is going to be carrying the information from the spinal cord to the brain, to the center that in the brain, which is called cortex, to receive that information. And when it is being successfully getting to the cortex, then the cortex is going to perceive the pain. And again, it depends on the person how this perception is going to be affecting the health and the emotion and the daily function. And everybody is going to be responding to the pain differently. It's very subjective. And but the thing is that the job that we have is that we're trying not to get the pain to the cortex level, and we would like to stop that pain and treat the area that's causing the pain. So what is the manual therapy aim for? Is helping with the movements and changing the structures and reducing the inflammatory chemicals and in the area that's causing the pain. And the effect of that neurologically is very immediate. And again, it depends on the duration of the issue that the patient has. Is it acute or chronic or somewhere in between, or is it subacute, whatever it is. The duration of the treatment is going to be different. And but the thing is that unfortunately, for many reasons, could be because of the financial or time or distance, whatever it is, the patient is expecting to get the pain relief right away, 100% with one treatment, and usually that is not going to happen. And again, sometimes it does, many times it doesn't, and it is all because that the pain is being received long after the issue has started to cause the problem. And so in order to perceived by the brain, by the cortex, it has gone days or weeks or months. So in order to get it back to normal, and that is going to be taking sometimes, and again, it depends on the case to case. And it helps with the inflammation and reducing the chemicals in the joints that causing the pain, and vasculature reformation and back to normal. And all of those are going to be helping with the pain. And one of the things that is affecting the pain is the sympathetic nervous system that the sympathetic nervous system, it is good for us to have for many, many, many reasons. And one of the things that it does, it causes inflammation in the area of the motor joint dysfunction. And so with doing the soft tissue work, manual therapy, as well as the physical therapy with the passive and active therapy that the patient receive, the aim of that is that get the patient back to normal, and so they can enjoy their health. And then again, a good health is the best wealth. And this is Dr. Marzban from Marzban Family Chiropractic and Complete Injury Centers from Dallas, Texas. You have a wonderful day. Bye-bye.